It is alarming that depression is becoming more evident among the youthful population. According to Dr. Sonia Nixon, Senior Medical Officer in the Ministry of Health, statistics show the two leading causes of death among 15 to 29-year-olds are as a result of depression, brought on by alcohol and drug consumption.
A lot of young persons who come to mental institutions are because of substance use, right? Substance abuse. And so they get psychotic, they become very ill, the whole thought process and the behaviors are changed remarkably, and they're taken to hospital. So that's what the use of substances by adolescent population has actually gone up, and that includes our girls drinking a lot of alcohol.
As the world observes World Health Day today, April 7th, depression is the main area of focus. The theme for the occasion is Depression. Let's talk. 1 in every 4 people becomes depressed in their lifetime, to the point of them contemplating suicide. Nixon said this illness is no respecter of person, and as a related factor to mental illness and the stigma attached to mental illness, people refuse to talk about things that are affecting them. It should not be left to a stage of chronic before being treated, she said. Some of the signs of depression are people exhibiting withdrawal symptoms, having thoughts of harming themselves one way or another, lack of motivation and drive, loss of appetite or eating too much, and lack of sleep. The support systems are available, but people need to seek out the services. There is hope.
There was stigma attached to mental illness, and we're concerned here because depression has a very bad outcome. It can, which is suicide. That's the worst of the worst. But also depression is quite preventable in some cases, where there's situations that may cause you to become depressed, and you don't have control and you become very hopeless and all the rest. But you can be treated by medical help. You can get that kind of medical therapy, or there is always psychological talk therapy, different modalities of psychotherapy, but there is help.
Nixon believes in spite of efforts made by officials, much more can be done in addressing the problems of depression and mental health.
I think the mental health services are doing the best they can with whatever resources, but definitely there's a lot more we can do. I'd like to get to a point where, let's say I had mental illness in my family. Let's say, all of us have this. We get our medications. So I'm not afraid to talk about it, So there is a lot left, having family support groups, having more psychological support, having more preventative facilities.
April 7th marks the anniversary of the World Health Organization. Chrislina John, GBN News.